afternoon, friends. A warm welcome to a wet afternoon. This is Dr. Reshma Pawar, Executive Director, Kolhapur Cancer Center. And today I am here to talk to you about a topic which is very dear. I won't say dear, but a topic which has become a point of concern amongst us doctors, we, the caregivers. Let me first introduce myself. I am Dr. Reshma Pawar, Executive Director, Kolhapur Cancer Center. I am looking after the administration of Kolhapur Cancer Center. I'm a gynecologist by qualification, but have done some further education in management. Kolhapur Cancer Center doesn't need introduction to most of the family physicians around this area. Today, I'm going to begin a series of webinars which will be hosted by Kolhapur Cancer Center under the heading of Insights on Common Cancers, Management and Equipping Family Physicians to Tackle Them. Kolhapur Cancer Center has been functioning in Kolhapur, in the western Maharashtra, North Karnataka, Goa, Konkan, Satara, this area since 2003, and we have been offering comprehensive cancer care to patients. Till date, we have treated more than 30,000 patients. We have done more than 10,000 surgeries, and we have given radiation to more than 10,000 patients. Kolhapur Cancer Center was the first center in this part of Maharashtra to bring state-of-the-art radiation therapy center and to bring all the facilities under one roof. We have been gradually growing and offering all the modalities of treatment under one roof. This includes surgical oncology, medical oncology, radiation oncology, bone marrow transplant, hemato-oncology, pediatric hemato-oncology, oncopsychiatry, oncopathology, pain and palliative department, and many more. The treatment to any cancer is extremely important to be understood, as the outcome of any cancer depends on the stage at which the cancer is diagnosed. There is a direct correlation between the stage of the cancer and the date or the time when it was diagnosed. Earlier the diagnosis, better the prognosis. So much so that in most of the cancers, if the cancer is diagnosed and treated in the first stage or in the early second stage, the success or the survival rate is as high as 95%. And the onus of diagnosing these cancers in the early stage lies more on the family physician than the doctors who are treating the cancer, because it is very rarely that the patient walks into a cancer hospital with the signs or symptoms of cancer. It is a family physician who is usually approached by the patient with the signs and symptoms. Hence, the family physician has to be totally aware of the possible signs and symptoms of any cancer and the recent advances that are being made in the diagnosis or in the treatment of cancer. As I said before, cancer treatment is a total teamwork. In the cancer center itself, we have a tumor board which addresses a cancer through all the modalities of treatment. All the consultants come together and decide what the treatment should be, and usually it is a multimodality treatment. That is, more than one type of treatment is given to a cancer patient. But this teamwork is incomplete without the active participation of the family physicians. The family physicians play an important role right from screening, diagnosis, referring the patient for further treatment, actual treatment, post treatment follow up, prolonged follow up, then again screening, then palliative care if needed, and end of life care as well. Thus, the family physicians play a major role, I would say a more important role than the actual treating doctors when it comes to treating cancer patients. So, Kolhapur Cancer Center has taken this endeavor of starting a series of webinar where we would be imparting information and education about the commonly occurring cancers, their screening methodologies, how to diagnose them in the earlier stage, how to motivate the patient to get treatment, how to help the treat patient through the treatment, how to take follow-up care after the treatment gets over, how to mobilize and motivate the patient to complete the follow-ups which have to continue for years together, and also to pick up early recurrences and to take care of the patient during the palliative stage and also in the end stage. It has been observed that the patient connects much better with the family physician during the course of such a gruesome disease. They are more comfortable with the referring doctor, and this really helps us in taking care of the patient. Besides, a patient would not be able to travel 500 kilometers, 200 kilometers for every small problems during the treatment or after the treatment. So, in such cases, the family physician who is attending the patient can take care of the patient, thus relieving the patient of lot of trouble of traveling to the main primary care hospital. All this will be possible only and only if we are able to understand and treat them as and when needed. Keeping this purpose in our mind, we have decided to start this series of webinars where we will be enlightening all the family physicians of the various organs, their signs and symptoms of cancer, and how to diagnose and treat and take care of them during the follow-up period. Kolhapur Cancer Center is fully equipped with all the possible departments of which are needed for the treatment of cancer. Not only treatment, the primary, it starts with the preventive oncology department, wherein we have a department which works actively in taking measures in trying to prevent cancer. Now, oral cancers and breast cancers, which are so much on the rise, are defined as lifestyle disorder cancers. These are the cancers which can be prevented to a big extent if one makes changes in the lifestyle. So, through our preventive oncology department, we impart this knowledge to people at various platforms as to what lifestyle modification one needs to do so that we have less exposure to these cancers. Then we have many screening packages which helps in early diagnosis or diagnosing these cases in the pre-malignant condition. Also, we have a mammography mobile van, which is known as the Hope Van, which has been donated to us by the Indian Cancer Society. Through this van, we have an innovative project wherein we reach to the masses of the rural population so as to do their mammographies, oral checkups, and pap smears for these cancers, which are the commonest over here. After screening comes the diagnosis. So, for the diagnosis, these webinars are going to be very helpful, which will help you all to understand the common signs and symptoms and the stages when these signs and symptoms have to be recognized and the patient needs to be sent or referred to a higher hospital. After the treatment, the case doesn't end over there. The patient has to follow up regularly for the next 3 to 5 years, so to as to see to it that if there is any recurrence, it should be picked up in the earlier stages. For this, also, the family physician needs to be aware of the various schedules and tests that need to be done to follow up such cancer survivors. Through these webinars, we will also be enlightening and sharing you with the knowledge of the possible follow up schedules. Also, during the treatment, there are various things by which we can help the patient by providing them services at the local family physician level, like taking care of Ryle's tube, Foley's catheter, dressings, jejinostomy, feedings, and all these things. So these information will also be imparted so as to give services to the patients at their doorsteps by the family physicians, and thus helping the patients in their compliance in completing the treatment. Also, after the treatment, there are many side effects which need to be taken care of, which can also be tackled by the family physicians. Now, medicine is an ever growing era. Every other day, there is some of the new recent advances that is going on in the medicine, which one needs to be aware of. Through these webinars, we would also be imparting knowledge to the family physicians about the recent advances in the management of these common cancers. The world of medicine is going so fast that the treatments which were the most important treatments few years ago have become obsolete. Hence, it is extremely important for all of us to be aware of the recent advances in the treatment so as to give the best to the patients. Besides, through these webinars, we would also be informing you about the various government schemes and the other financial facilities that the center offers for the treatment of the various cancers that we treat. The recently introduced bone marrow transplant facility in Kolhapur Cancer Center is one of its kind, with all the latest technologies, staff needed, and the expert faculties. Bone marrow transplant is not a treatment which is frequently used because of lack of its availability and also because of its financial constraints. We at Kolhapur Cancer Center are ably funded by crowdfunding like Impact Guru and also by Keto Foundation, and we are also a CanKid associated hospital unit. Thus, most of the cancer treatments who need bone marrow transplants get an adequate funding. Thus, we would like to um, extend our services to people and children who need bone marrow transplant, because children are the people who are going to take the society across, and it is the responsibility of every doctor to see to it that every child gets the treatment he needs. We have recently been equipped with the 32 slice CT scan, which helps us greatly in accurately diagnosing the cancer patients. And it's been over 8 years that we have had the best of the technology for radiation therapy, that is a triple energy linear accelerator. Going in lieu with the advancement, our new second radiation machine is coming, which is known by the name of Versa HD. It is a top line machine, the most latest technology in the world, which helps us in treating moving objects more precisely. Along with that, we can do stereotactic surgeries and stereotactic treatments, which are a very fine and highly advanced treatments for cancers of the brain and lung, thus keeping its promise of giving the best in cancer care to the rural population of Western Maharashtra and Karnataka and Goa. Kolhapur Cancer Center is continuing its journey of getting the latest technology, the best of the faculty, and best of the services to the doorsteps of the people. This webinar series is a small step in furthering this mission of ours. So, this webinar, we would be having a lecture by the eminent faculties every 15 days on a Saturday, where each organ would be tackled and explained in very simple words as to how to diagnose and refer the patient. This is an introductory session where I would not be going into much details, but I hope that you would continue watching our webinars, which definitely is going to help us in giving the best cancer care to the needy. Thank you so much.